This virtual consultation is on upper blepharoplasty. You can watch the other companion video on the lower blepharoplasty if you're thinking about having that procedure done as well. So the upper blepharoplasty is really nice because it can be done totally awake, unlike the lower blepharoplasty, in my office with some numbing cream. And I put the numbing cream on for about 45 minutes to an hour, and then I do the procedure and you're done in about 20 to 30 minutes. It seems scary that you're gonna have a lot of pain, but my patients have very little discomfort during the procedure and a very short recovery period as well. So the goal of an upper blepharoplasty is really just removal of some extra skin. Who is a good candidate to have this done? The candidate is someone that has crepey looking skin that looks dirty, unhealthy, uneven. Taking a little of that skin away can make it look so much better. Or if the skin is actually hanging so low that they've lost the crease, or the skin is hanging over the eyelid margin, like over where the eyelashes sit, that just doesn't look good. So a little skin removal is what I would do for them. The recovery typically is pretty fast. Stitches come out at 7 days. Oftentimes, even during that time, there's very little bruising. There's oftentimes very little swelling, and the stitches oftentimes can be hidden underneath the crease itself. So you want to know where the incision is made. It's just made inside that little crease of your natural eyelid. So at the end of 7 days, stitches come out, and then you're good to go. Now, I do not allow you to drive home, even though you just had a procedure done in a local anesthesia, just because there's a risk of having a car accident or something like that. But unlike general anesthesia or sedation procedures, you could Uber home or have a driver take you home if you don't want to use an Uber. And after the 7 days, you're pretty much good to go. So it's a pretty fast recovery. Most patients are about 7 days. There's always a chance you could have bruising up to 2 weeks or beyond, but the majority of my patients have very limited recovery, very limited discomfort. I use an anesthetic in there that makes it numb for several hours, so my patients typically don't have much discomfort. Now, sometimes it's achier the first night, and then after that, that discomfort really is quite minimal. So let's dive a little bit deeper on who is a good candidate for this procedure. So I talked about crepey skin, having a little bit of saggy upper eyelid skin, that's obvious. But I want to use an analogy for you to understand really how my philosophy goes when it comes to upper blepharoplasty. The upper eyelid is like a balloon, and when that balloon deflates, what does it look like? It looks saggy, it looks hanging. So you think, I've got to take all this extra skin away, move it all away. But actually, like a balloon, if I reinflate it, it looks less saggy. All you've got to do is think about when you were younger. So oftentimes the upper eyelid brow area was not higher, it was just fuller. And so I believe when you take away all that skin, fat, muscle, not only do you have an incredibly long recovery time, but people just look abnormal. They look cadaveric and they don't look like themselves. So really the trick with this is minimal skin removal. And so I don't take insurance because I think insurance, they take way too much skin away, take muscle fat away. Not only do you have a long recovery, it just doesn't look normal. So I add volume back. So there's two ways to add volume. One is injectable fillers and the other is fat grafting. And so I encourage you to watch those virtual consultations if you want more in-depth discussion about those components. But the understand is adding a little bit of volume goes a long way. So if I'm doing a fat grafting procedure and I think you benefit from an upper eyelid procedure, I would be doing both of those together. So that would be done at the same time. However, if you said, look, I don't want to have deeper anesthesia, I don't want fat grafting, I would just like something to make my eyelids look better, office-based procedure just like your upper blepharoplasty, then in most cases, I would encourage to have a little bit of volume added with fillers. So that can be done, but not at the same time, but it can be done as an office procedure. The fillers I use are Restylane because they're all natural, they're reversible, they look great on the upper eyelids, and they also last. And so a lot of people don't do fillers in anywhere because they believe it's not going to last them a long time. But I use these little micro cannulas, looks really natural, and over time I've seen it last many, many years, and that's really the cool thing about fillers. So they really do last. But I encourage you to watch the video on fillers. It's 27 minutes long just on that virtual consultation. But adding volume goes a long way. So that's a big, big understanding of why I don't need to take so much skin away and why people look very natural afterwards. However, the timing is different from fat grafting. If you're gonna do a filler, I usually like to do it, like if you're doing the consultation, I could begin to do the fillers even that day. The minimum time to do an eyelid procedure would be about 2 weeks later as a minimum time so that I don't interfere with my fillers. On the flip side, if I'm doing an upper eyelid procedure, I usually like to wait a month to let everything heal before I begin the filler process. So for people that don't understand, hey, would a filler help me or not? I just don't understand what you're talking about because I'm convinced I have too much skin. You could always start with an upper eyelid procedure. And what's interesting, I tell my patients that do that, is all you've got to do is look at your eyelids about a week out when you're slightly swollen. You probably will think at a few days to a week that you look amazing. And then at 2 to 3 weeks, you think, hey, it doesn't look bad, but I wish it looked as good as it did at a week. Well, what is that? That little bit of swelling is what fillers look like. When you have a little bit of volume, it's actually what makes my patients look great. I used to do a ton of brow lifts. I don't do a lot of brow lifts anymore because I don't believe brows need to be that high. And when I did brow lifts, my patients really thought, wow, initially I looked so good at the first week. What happened, Dr. Lamb? This was before I was doing fat grafting, before I was doing fillers. And I realized it was called honeymoon swelling. That early swelling that occurs in that first 1 to 2 weeks is really, or first few days to a week, is really a representative of what volume adds to the equation. So if you trust me, understand that fillers would be potentially a good thing to start with. I would start with the fillers, and then I would have you come back maybe a couple weeks down the line and do the upper eyelid procedure. One other caveat. In general, I don't like to do Botox right before an upper blepharoplasty. And the reason for that is that I don't want the eyes to be artifactually opened up a little bit more or down a little bit more because I can't read exactly what I need to remove skin with. Because Botox is temporary, except for the healing properties of the skin. I don't want to have that Botox overlift the brows or drop the brows so that I can't read the skin removal. So in general, unless the brows are pretty much neutral, I like for you to not do Botox for 3 months prior to an upper blepharoplasty. So again, the upper blepharoplasty is an easy office procedure. You're completely awake with numbing cream and a quick procedure that takes 20-30 minutes with oftentimes just a few days of recovery time. But I really encourage you to start to understand that I don't think oftentimes just skin removal is the answer. So a little volume and a little bit of skin removal oftentimes can go hand in hand toward a better result.